Hello, everybody. Welcome to this Global Compassion Coalition webinar on transforming healthcare through compassion. My name is Michael West. I'm a Senior Visiting Fellow at the King's Fund in London and Professor of Organisational Psychology at Lancaster University in England. And I'm really delighted to welcome you to this webinar. We are experiencing hugely challenging times in our world and in our healthcare systems and organizations and communities around the world. And this webinar is really an opportunity to focus on how we can offer hope. I'm being joined today by 4 colleagues who I work with within the Global Compassion Coalition, focused on how we can transform and develop healthcare throughout the world. Today, we're going to be talking about the importance of compassion in healthcare, its role in transforming healthcare outcomes. We're going to talk a little bit about compassion and self-compassion amongst those involved in healthcare, whether in formal systems or in voluntary sector or in community groups, and about the importance of developing compassionate cultures through compassionate leadership. We'll talk about also compassion from a patient perspective, the importance of compassion from those who provide healthcare, the importance of compassion for patients in dealing with pain, the importance of self-compassion, and the importance of compassion and self-compassion in healthcare systems and in healthcare communities. And we'll talk about practical examples from different places around the globe that can offer us hope in these challenging times. So the process is, I'm going to introduce in turn each of the 4 members of the panel and ask them a question about compassion in healthcare, and then to talk in more detail about their unique perspectives that each of them bring to this issue. We are going to have an opportunity to explore your questions with the panel. And so please put your questions or comments as we go along into the chat. And hopefully by the end of the hour that we have together, we will all have more hope in the dark. So let me begin by giving a warm welcome to Katie Stewart. Katie is a good friend of mine, somebody I've worked with over many years. Katie's a consultant, a coach, and a board member of Oxfam GB, and has worked as an anthropologist and worked for 30 years now on the importance of culture in bringing about change or enabling change. And Katie has played a huge role in helping healthcare in the UK develop compassionate cultures. So a warm welcome, Katie. Thank you for being here today. And my opening question is really, how do you feel compassionate leadership can help us in these challenging times in healthcare?
Thanks very much, Michael. It's a huge privilege to be here, and I'm looking forward to today's conversation as much as anybody. As you say, I trained as an anthropologist, and that left me with a lasting interest, I think, in how you create environments and cultures which people want to belong to and feel a part of that community. So I've been in the NHS for about 20 years, and Oxfam is also...
That's the National Health Service in England, yeah. Mm.
And Oxfam, which is an international development organisation, is also an organisation which I know really well as a board member, but also recently supporting them with a new approach to decolonising. And that has really opened my eyes. It's been a huge privilege, particularly over the last 12 months, to visit so many of Oxfam's programmes where they are trying to work differently with partner organisations on the ground, shifting, if you like, the power to them and putting far more emphasis on local partners designing their own approaches. So many of those local partners are in health, they're in mental health, and they're also maybe supporting care. And what I've seen is that those grassroots organizations have to be allowed and have to be supported, because the overwhelm and the lack of, if you like, kind of structural mental health and physical health and care support and care workforce is global. It's not just in our country.
And so just to explore that for a moment, Katie, so the Oxfam as a development organization is in a way changing its relationship with these systems, these communities, to have a more compassionate approach, listening, seeking to understand the challenges they face, empathizing with them rather than imposing things on them, and then taking an orientation very much of how can we help rather than dictating the way that things should evolve. Is that right?
Yeah, that's absolutely spot on. And I think that learning to listen really well is difficult for us as individuals, but actually it's really difficult to create a culture which is about listening and saying to partner organizations, how can we help?
And a lot of that, I guess, is about being present also with people, of actually connecting rather than operating at a distance. Can we come back to that, Katie? It's a really important point. I'd like to introduce now Vidyamala Birch. Vidyamala is the founder of the Breathworks Foundation. A really warm welcome to you, Vidyamala. Breathworks Foundation is an international meditation and mindfulness and compassion charity. And you began teaching your mindfulness approach for managing pain and illness, Vidyamala. I know from your own personal experience living with health challenges following spinal injuries and surgery when you were much younger. And as a result, you began exploring compassion and mindfulness as a really important way of managing of pain. And how did that go for you?
Oh, thank you, Michael. And hello, everyone. As Katie said, it's a great honor to be here. Well, I had an experience when I was 25, so it is a long time ago now, where it was quite a direct insight into the fact that my experience of pain was mediated through awareness. I won't go into all the details now, it's a bit of a long story, but that my perception of pain or my experience of pain changed depending on what I did with my mind. And that was really astonishing because I hadn't learned that anywhere. But it planted a seed, and I got very, very curious. Well, what is this mind? And more importantly, how can I train my awareness? How can I train my mind to be present, to be kind, as a way of reducing what I call reactive pain? So I can't necessarily change the sensations, some of the sensations that I have from my injuries and my disability. But I found that my quality of life has transformed beyond all recognition through these, I think they're simple practices. I think that's something I feel quite dedicated to in terms of getting us out into the world. It doesn't need to be esoteric. It doesn't need to be complicated. Really, it is training the mind so you know what you're thinking, you know what you're feeling, you know how your body is, and you can make wise choices as to how you respond. And so awareness is important, but also compassion. Compassion being a sympathetic, if you like, response to suffering, your own and others, as well as a desire to alleviate that. So, but I think of compassion as being the heart. So we have to have the heart side of things involved if we are to be effective.
And is there a sense, Vidyamala, that compassion then is not about resisting pain, but to some extent engaging with it?
Yes, well, it's quite interesting what Katie was talking about of in Oxfam, the need to engage and to listen. I think it's not a dissimilar thing, to engage and listen to your own experience, and then to figure out what is actually happening here. Because the story can be, well, my back is killing me, but when you come closer and engage, you think, well, actually, no, my upper back feels fine. My lower back's got these sensations, and I'm resisting. So it's the resistance that causes most of the suffering. So how can I soften that, and how can I be with that, and how can I breathe with it? How can I be kind? So it's quite, I'm seeing, it's quite interesting. That's in the individual sort of inner world, exactly the same thing that Katie was talking about, more systemically or institutionally or structurally. And then we've got lots and lots of people, and I see it replicated, this kind of light bulb moment of, I can learn how to turn towards this experience gently and kindly, and to soften all this reactive tension and very difficult mental states and so on.
And for you, it was life-changing and transformative. Thank you, Vidyamala. So from the individual level now to the national level, and I'm delighted to welcome and engage in the conversation you, Helen Thomas. Helen is Assistant Director of Leadership and Succession at Health Education and Improvement Wales, and I've had the privilege of working with Helen over recent years, supporting Wales as a country in developing a 10-year strategy to develop compassionate leadership across the whole of health and social care. And for me, it's been truly inspiring. So, Helen, from your perspective, why is compassionate leadership and compassionate culture so important in the whole healthcare system?
Thank you, Michael. And I'm humbled to be here and listen to colleagues here. I'm already learning so much. From our perspective, I guess, Health Education and Improvement Wales is the strategic body for workforce for NHS Wales, and you'll all be aware of the global crisis and the fact that we are struggling to attract our workforce as well as retain our workforce. You've seen the strikes. People are unhappy because of the environments that they're working in. So culture is critically important to creating those conditions for people to want to join at the National Health Service in Wales. Culture is important for us retaining our workforce and showing that we value our workforce. And it's also critical in order for creating effective teams that have that ability to be safe, to be able to challenge, to have the autonomy, to feel that sense of belonging, but also then to be able to undertake improvements to improve the services that we provide to people across NHS Wales, as well as our patients that we are here to serve. So I think culture plays a significant role in everything, and I would say it's the golden thread through everything that we want to achieve. So we are focusing clearly on creating that compassionate and collective culture across teams and workforces in Wales to help us achieve better services, retain and attract our workforce.
Thanks, Helen. And I think what I've been aware of in all the work that you're doing in terms of trying to transform a national health and social care system is that a lot of what you do is about listening to staff in your health and social care services across the whole nation and really engaging with them to understand the challenges that they face, and a lot of I suppose caring for them as well, in the sense that you're not avoiding the reality that many of them are under huge workload pressure, high levels of stress, difficulties balancing the demands of their lives outside work, paid work, with their lives in work. And then I guess the strategy that you're implementing is trying to help at a national level to transform all of that. So it's kind of embodying the principles of compassion in the way that you're working.
Absolutely, yes.
And then our next guest, again, a really good friend and longtime colleague, is Dr. Rachna Chawla. Rachna, warm welcome to you. You're Joint Director of Clinical Strategy at King's Health Partners in London. You trained as a general practitioner and you've worked in general practice for many years in London, and part of the Healthcare Management Initiative at INSEAD Business School in Paris. And you've previously worked in so many relevant areas: a health tech startup, a large pharmaceutical company in Milan, and with the King's Fund on compassionate leadership and innovation. And so I guess across that broad range of organizational types and sectors, how have you, why have you come to see compassion and compassionate cultures as so important in healthcare systems? And communities?
Thank you for having me here, and great to meet everyone. I think your question goes to the core of compassion being essential when we work together in teams and we're human beings coming together for some sort of collective endeavor, but especially so maybe coming to the point that Vidyamala and Helen made, which is about embracing, not just acknowledging, but embracing the reality of whatever we are faced with, the difficulties that we have, the hopes that we have, the dreams that we have, whether it's, trying to figure out what to do in the midst of COVID as a GP when you don't have enough resources, trying to do the right things for your patients, or whether it is as an academic health sciences centre, which is what we are at King's Health Partners, and trying to understand how do we better engage with our communities in a way that we've never done before. Before you can do any real engagement, you sort of have to acknowledge where we're all at and sort of deeply listen to the other's perspective to then build a place from which we can take steps forward together. So I'd say it's essential. And as a GP, for me, it's the essence of what happens in a consultation or an exchange with a patient. It's why we go into medicine in the first place. So it's there at the heart, just like Vidyamala was saying.
And so in your interactions with patients, compassion is so important. I mean, we know when we ask patients what it is they want from clinicians, that they want clinicians who are present with them rather than kind of lost in their computers or whatever. They want people who listen to them, who understand, who clearly understand the problems or difficulties they have. They want people who care for them, and they want people who have an intention to help. And I think there's some evidence as well, isn't there, that when GPs are more compassionate, if they try to be more compassionate, benefits them. Is that right?
Yes, I mean, all of what you said is true. And I think, I don't know what the evidence is, but you can feel it when you've had a compassionate connection with someone who is there on the other side of the table from you, because both sides feel it. That's where the sort of real communication happens, when in that healthcare setting, you connect with someone deeply. So yes, completely.
And connection and belonging are fundamental to what it is to be happy and healthy as a human being.
And I should say that you also notice, or certainly as a doctor, I've certainly noticed when I've missed the queue also.
Yeah. So, of course, coming from the backgrounds that some of us come from, we may get hung up on national healthcare systems, but many countries don't have necessarily sophisticated, nationwide public healthcare systems. And Katie, from your perspective, why is a community volunteer perspective so important to understanding how we can transform healthcare around the world?
I think there's so much to be learned from a compassion perspective in relation to the community setting and to the grassroots setting. I mean, in a sense, the gaps in healthcare are being filled by deeply compassionate people who want to improve the health and the well-being of their local communities. So they are already stepping into that gap and taking action based on a real understanding and an empathy, an empathic connection, I would say, with their communities. And there's something very special, I think, about compassion, which is this sense that we're all in it together. So I know that there are conversations about whether compassion is innate or whether it's a social function. I mean, for me, it is embodied by people leaning in, wanting to make something which is right for a larger number of people. It's this sense of being all in it together, being motivated to help something for the community. And when I think about some of the programs some of the partners that Oxfam is working with, I think of organizations like Aid and Hope, which is a cancer organization that I visited in March. It is one of a number of programs in Palestine that Oxfam is supporting, and it is in the Gaza Strip. It has this year supported 300 women and girls to be treated for cancer in the King Hussein Hospital in Jordan. And I would say it has a lot of characteristics of what I think of as grassroots organizations. They're there through thick or thin. So they will be back after COVID, and hopefully they will be back after this humanitarian crisis. They have a deep connection with their community. They have a really steadfast commitment to using volunteers in a way which is meaningful. So the volunteer women are more likely than not to be women who have had cancer and been supported by the organization. And they're jointly co-designing new approaches to supporting other women. And they are doing what I think is really interesting, is that they are also challenging local social norms. So by using volunteers to talk about cancer in public settings, to talk about the impact of cancer on mental health, to talk about mental health in women, these are what I think of as being really community approaches to some really difficult problems, which have to be addressed in a local context, surely. And so I think there's something very, very profound about that. And I think also that there are lots of good examples around of health practitioners who are understanding the importance of engaging the community, listening to stories, creating cultural safety, if you like, for patients, for women in childbirth, so that when they work with them, they're using local knowledge, local histories, local stories. And that, of course, is something which is close to Oxfam's heart, because I think it's fair that colonial history has created a lot of divides. And I'm thinking of Australia, where creating cultural safety and training midwives in how to create cultural safety is part and parcel of helping to create real trust-based relationships between midwives and women from the First Nations.
So Katie, your reflections are really powerful, and we're all aware of the harrowing events in the Middle East over the last weeks, and it must be particularly harrowing for you, I know, given the work that you've been witnessing in Palestine and indeed in other places, and but also I suppose the deep insight that healthcare is not always about formal healthcare systems, and a lot of healthcare is about informal relationships and informal volunteers who are working either alone or in concert with institutional agencies. I'm thinking of things like the NUCA system in South Central Alaska, which is very much a citizen-owned approach, working with the native communities, the indigenous communities in Alaska, to bring about transformative change in patient outcomes. And so in a way, I think the themes you're describing are probably relevant very much to your orientation as well, Vidyamala, because there's something about how the patient perspective can get lost in formal systems. So can you say, I mean, it kind of in one sense might be self-evident, but why is it so important that these perspectives are present in healthcare?
Well, I think it's very important both for the patient, I'll call that person that for the purposes of this discussion, to feel engaged. And I think there's a very pragmatic answer as well, that you're going to get better outcomes if the patient is developing a sense of agency. And I personally think we need to move from a model where the patient's the kind of passive recipient of this, something that's given to them from somebody else, to the patient being a partner. I think the sort of partnership model is very good. So I I need some traditional medicine to help me. I take medication. I need treatments every now and then. But if I can go there saying to the healthcare practitioner, can you help me? Work with me so I can manage my condition. That's very different from going and saying, I don't know what to do, can you fix me? So we have this kind of fix it approach very often. And something, I think 2 in 3 GP visits now for long-term health conditions for chronic diseases. And our health system, certainly here, is not really set up to manage chronic diseases. It's set up to manage acute problems. So we've got this problem of people going back again and again and again to their healthcare provider for a solution that the healthcare provider isn't really able to give, because a lot of chronic diseases can't just be fixed just like that. So there's this movement now towards empowering patients and for the healthcare providers to work with patients to work out what your values are. You know, why do you want to work on your manage your health better? You have to work out what it means for you, and then to motivate the patients. And very interesting work around behavior change. And this more sort of patient-centered behavior change is something like 80% more effective than if you just go to the doctor and the doctor says, well, you know, you need to stop smoking or you need to exercise more. The patient needs to know why. Why is that important for me to fulfill my values? So I think that that's the main thing we need to do, is move to a more partnership model. And there needs to be compassion and self-compassion in there. Compassion from the healthcare practitioner to the patient. And also when I go to a doctor, I try to have compassion for them. You know, here's this really hard-working person who's given me 10 minutes. How can I help that person help me most effectively in those 10 minutes? And so the empathy and the connection goes both ways, I think, to realize the healthcare practitioners are humans. You know, it's very easy when you're a patient to think somehow their lives are perfect and it's only your life that's a mess. Or we've all got imperfect, messy lives, haven't we?
And does that resonate with you, Rachna, as a GP?
Oh yeah, I mean, my duty doctor shifts are a complete mess, completely messy shift when I'm working there. Yes, I mean, our patients are so sweet and compassionate to us, really, especially the ones that we get to know over time. There is a sense of understanding. They understand our pressures, and I think that's the beauty of general practice in England, is that we're in the community and we're part of the community. And when that's there, actually, we can build from that place, because then you've got a partnership from which you can build something together. So yeah, it does resonate.
And as you say, Vidyamala, you know, we have lots of evidence that when clinicians are compassionate, that leads to better outcomes in terms of a shared understanding of agreed treatment protocols, better clinician understanding of the problems. So these behaviors of compassion are, in a sense, there's a mutuality to it, I suppose.
Yes.
How do you think we can? What can we do better around the globe to ensure more patient involvement and ownership of healthcare?
Gosh, that's a big question. I think it's both top down and bottom up. So sort of that Katie's talking about grassroots. I mean, anyway, my organization's very grassroots. I started running courses 23 years ago, and now we've got hundreds of thousands of people around the world and a pool of volunteers. And at the moment, I'm designing a new program around lifestyle medicine. How do you help people really sort of engage with things like nutrition and movement and sleep, and using awareness and kindness as a foundation of that? But the way I'm developing that program is working with pilot groups of people to work with me to design the best program that we can, rather than me just sitting back in my ivory tower and, you know, dreaming something up. So that's exciting. But I also think that there needs to be top down. There needs to be inspired leadership. So the sort of work that Helen's doing and that you're doing, Michael and Rachna, you know, that often top down is where the money is. So, you know, there needs to be people in leadership positions working with people in grassroots positions, and you do a sort of sandwich, I guess, to bring about lasting change.
And you've reached hundreds of thousands of people, Rachna.
I was just going to say, I think there are two additional points in here. One is around sustainability, because we can't carry on as we are. So whatever the future is, it has to be partnership based. And one is around acknowledging the problems that we have with trust in our system. Therefore, it has to be partnership based and has to be one where, this isn't quite the right term when I say share the power, but unfortunately, from the perspective of our infrastructures, that's sort of what it is. And the work that we've been involved with in Southeast London has been really eye-opening, especially when we've worked with community interest companies who are embedded in the community, who have the trust of their community, who've carried out insight studies for us. It's completely humbling to understand the trust that they have and what they're able to, the questions that they are able to ask and the answers that they're able to get, which in a way we could ask the same question in a hospital setting or a GP setting, but I would not get the same answer because that level of trust is not there.
Can you give us an example, Rachna, of one of those community interest companies?
Yeah, so we work with a company called Mabdalico based in Lewisham, and they have done now 3 insight studies for us. One was around blood pressure testing at home during COVID. And we offered a pilot in Southeast London to 70 people who were at high risk from the perspective of data. Only 7 people took up the pilot. And we thought, well, why is it that the other 63 didn't? And normally, you know, you might not go and ask the other 63, but actually they did. And they went and found these other people and they asked them. And they discovered that actually it came down to trust in the way that this pilot had been instructed and so forth. That then led to some further work where we really wanted to understand what are the barriers to people from especially Black and African communities to engaging with primary care when it comes to blood pressure and hypertension, which in that community prevalence is really high and they're at risk. And again, what we heard, actually some quite difficult things we heard, was that we are sometimes the barrier. That we're always asking our communities to change, but we never want to change. And, you know, we couldn't have asked those questions to have gotten those answers. We had to have someone who was trusted in the community, who could kind of leverage their trust in order for us to get those answers. What work that's now led to is them working in the community to create a blood pressure testing protocol to then allow community organizations to carry out blood pressure tests in the community in a way that is robust, where then GPs and primary care networks are invited to come and take part and support, but are not the leaders. So actually it ends up being a community-led, community-centered project where the NHS is invited to support rather than the other way around. And hence the sharing of power has sort of flipped.
So that theme of trust and partnership you talked about as well, Katie, in terms of local communities and volunteers. And I think that that's quite a profound message about the future, because in a way, the challenges that we face in healthcare internationally are increasing demands and limited services. And the only way we can ensure the well-being of people is if all of the agencies work together with the communities, with patients, with families themselves, and actually it's trust and partnership with the people who provide healthcare too. And I mean, Vijayamala talked about top down and bottom up, Helen, and you've been developing compassionate approach across health and social care in Wales for I think 3 or 4 years now, doing a huge amount nationally. Can you say a little bit about how that's what you've been doing and how that's going, and what others can maybe learn from what you're doing in Wales as a national case example?
Of course. Yes, and Vijayamala was very articulate there, and top down, I think, but collectively was the approach that we used initially. We consulted with as many interactive agencies as we could, not just employees, but voluntary sector, public sector, etc., and asked these individuals what type of leadership did they need, what type of culture they needed, and we harnessed all of that information, and the themes were coming out really clear that they wanted to see and interact with individuals that had integrity, that had compassion, that would listen to them. So we distilled all that into our approach to leadership for health and care in Wales, and it resulted in our health and care strategy. 7 themes come out of that strategy, and compassionate leadership is one of the core themes in there. And what we started to do was look at how do we provide these conditions, how do we support colleagues and organisations to develop skills that they could attend, that they could understand, empathise and take action. How would we put a framework around that to help individuals at all levels show and demonstrate leadership skills and create that culture that we needed? So we launched the workforce strategy, and then we took it a step further and asked, well, what sort of leadership principles do we need to underpin this? And again, working with your expertise, Michael, and working with our colleagues across the UK, as well as a huge number of stakeholders, we developed 7 leadership principles. And these principles literally now set the conditions for what we expect in health and care in Wales. So not only do we have a common language, but we have a common behaviour and some common principles to set the conditions that we want to experience as employees of health and care in Wales.
And I've been impressed by how in Wales you have other activities going on. There's Future Generations Act from Welsh Government, which says any legislation must protect the well-being or promote the well-being of future generations. There's other legislation on well-being in schools. So you're beginning to work across boundaries, not just in healthcare, around developing this national compassionate culture. And I just want to also say that I'm aware that a lot of the work that you've done is available for people to look at on your website. It's Health Education and Improvement Wales Leadership Portal. I think I've got that right. And you can search all of that and see this huge range of wonderful work that you've been doing. I think practical examples give people hope. I read Rebecca Solnit's wonderful book, Hope in the Dark, this summer, and her impassioned argument that we create hope in the dark times by taking action, collective action together. So I think those case examples really at national level, at local level, as you've described, and Rachna, are there any other examples? You offered the one about the Community Health Initiative. Any other examples of compassionate interventions that you've seen make a profound difference?
Yeah, I've got 2 maybe that I can share. One is about an amazing barber called Kevin De La Rosa from Neasden, who quite by himself, because he would hear men come into his barber shop and talk about mental health, and sometimes they talk about their prostate worries and things, would start a mental health day or a men's health day, and then involve a local GP or sometimes the urologist from guys from our hospital. And he started this completely on his own. So I think there's something about acknowledging that actually some of this work is already happening within the community by these amazing people. We did a webinar with him, and he streamed in live whilst he was cutting someone's hair to tell us about his initiative. So I think there are initiatives like that. We've got a local GP who would go along to the local drafts tournament and offer blood pressure tests to whoever wanted to have them done, just because it was on community turf rather than the conditions that are required for people to come into practice. And then maybe the COVID vaccination bus is a great example as well. We had the COVID vaccination bus that went to Peckham Library during the waves of COVID, and there was a man there who he had a can of alcohol in his hand, and if he had approached a GP practice, actually most GP practices would not have allowed him in because he had alcohol in his hand. But when you're in a community setting and you're in the midst of a pandemic, trying to understand what's the safest thing to do, we engaged in a conversation with him about the COVID vaccine. We understood that he was able to make a decision, and he decided to have the vaccine. So these are just some really small little examples about how doing things in a different setting and with community can change the dynamic. If there's time for one more, I'll tell you one more, but I know that we might not.
Tell us one more before you tell us one more, Rachna. I'd like to just say to all of those who are watching and listening in that we really welcome your questions or your comments. So please do add them to the chat, and we'd really very much welcome those, because we want to address the issues as well, which are of concern to you. So please do share the other example, Rachna.
So the last one is, I guess, the theme so far in the examples I've told you about what one person can do, and actually so many things just start with the the vision and the heart of one person. And this story is about Brindeshwar Pathak, who was an Indian sociologist who passed away this year. I didn't know much about him until I read his obituary recently. And he was a pioneer when it came to sanitation in India. He noticed at a very young age that there was a certain class or caste in Indian society, the untouchables, not called that anymore, but the Valmiki caste, who were really shunned. They did all of the cleaning work of the open toilets that were ubiquitous in India, and they're very much oppressed. And this class, mostly women workers, sort of weren't allowed to lead dignified lives. And he was so touched by their, the inhumane way in which they were treated that he became a sociologist. He then, during his PhD, lived with them and understood that if he was able to do something about sanitation at a mass level in India, these people could then be offered alternative training and alternative employment, and therefore be enabled to live more dignified lives. And he has uplifted something like 200,000 women. He's built millions of toilets in India. It's really worth going to look up more about his work. But just to say, it started with one person being touched by the suffering that he saw in another that started an entire movement.
And I think, sorry,
go on,
I just
Katie, please.
build on that? Because I think that one of the lovely things about that is it's a really nice example of the kind of courage that's needed to be compassionate. It wasn't given to him. He went out to search it. He challenged what might have been conventional social expectations. And I think you rightly said, Rachna, that there's an awful lot of this stuff happening, but actually every one of those is showing quite a lot of courage, I think, pushing boundaries.
Mm-hmm.
There's another project that I heard about recently. It's in Sheffield, actually, Michael, where you live, called Heroes of Health, I think, which is essentially getting people walking and talking in their local environment, socializing, positive social contact, exercise movement for people with chronic health conditions. And they say they've got a 75% reduction in disease, a 48% decrease in GP visits, and it costs £5 per person per year.
Wow, that's extraordinary. Yeah,
exactly.
Yeah.
Little startup project, could be really easy to replicate. And one of the things I like about some of these projects is, they're not rocket science. It doesn't necessarily take all that much for us to shift things, like the barber. He's a guy cutting hair, and he just starts talking to guys about their health, and he would have had a huge effect on people. So I find that very encouraging and optimistic, that it doesn't take much sometimes to make a big shift.
It also shows where ideas come from and where improvement comes from. And to your point about bottom up versus top down, it happens through conversations. It happens around an observation of need. It's something which is interpersonal. And I think sometimes we think about improvement as a set of project plans which come down from the top with targets attached to it.
Margaret has asked a question that I think is pretty pertinent in terms of compassion. One of the things that we saw during COVID in many countries was a move towards more remote consultations. And I'm interested to observe that the countries that apparently do most remote working are Canada, number one, the United Kingdom, number two. The least remote working, I think, South Korea, Greece, and France. And it's a question about when we do remote consultations or when we have remote healthcare interventions, does that make it harder to pick up on the subtle signals of connection that you've all referred to?
Yeah, I can maybe start on that one. I think it can certainly make it harder. You know, during COVID at the beginning, we really had no choice. We had to just go to remote and do our best. You can still, with a remote consultation, do your best to maintain eye contact through the camera and make sure that there is quiet space for someone to speak and to listen. You of course don't have the beauty of touch, which is so important in healthcare, to be able to hold someone's hand, to sit near them. I think remote consultations have a place, and I think what they've done, certainly in our practice, is that we have become a bit more sophisticated in understanding who might need initial remote consultation that then needs to be converted into a face-to-face consultation. For example, a medication review is a sort of more of a transactional consultation, and that can be done remotely, whereas perhaps seeing someone about a mental health problem for the first time, ideally, of course, you do that face-to-face. So I think that there are some nuances about it, and some things, of course, get lost on a camera, but you make the best of what you have. And like I said, in our practice, what we've now done, because we've got a hybrid model, is that we've made our face-to-face appointments longer. So we have 15 gorgeous, glorious long minutes, which is so different to 10 short minutes, which I hope in some way makes up.
At the same time, you know, we've talked today about the importance of working across boundaries, working with community groups, working with voluntary groups, working with those nascent groupings of people who just want to make a difference for their neighbours and their communities. And that cross-boundary working, we know, is primarily enabled by connecting, by spending time together. And of course, you know, if we spend time physically together, that connection is deeper and richer. So there's something very important about understanding the need for connection. Pablo has made the point, I think, and maybe this is something you can comment on, Vidyamala, about compassion for caregivers. That, you know, sometimes we leave caregivers out of this, but they maybe are the key people who are important for the health of people who are in pain or suffering.
I think I'm really glad, Pablo, that you've mentioned that, you've raised that, because it can be a forgotten group, I think. As you know, they're not necessarily seen in the way that the person with the health condition will obviously be. They'll get their attention when they're seen by a healthcare provider, and the healthcare provider gets their attention through the role and so on. So I think, yes, we need huge compassion for caregivers. And no, I suspect, I don't know, this is speculative, but certainly in our country, with the aging population, with the financial pressures, there's going to be more and more voluntary caregiving needed, I think. Also, people living a lot longer. So you might have, you know, a grandchild, you know, someone, a child in their 20s, and your parent is still alive. So the sort of intergenerational caring, I think, is going to be more called upon probably. So yes, absolutely. Let's not forget the carers. And again, it comes down to these simple skills of listening, being kind. You know, the person who's needing care, being kind to the person who's giving care, and just I think the skills that what I'm hearing from all of us through this whole panel is the need to listen, the need to be kind, the need to give space, the need to empathize, and yeah, let's not forget the caregivers.
Yeah, so
society.
I have my 2-year-old grandson in the house at the minute, and my 97-year-old mother is not too far away. So I feel the joy and the privilege of that, caring in two directions. So we've got a question in the that's come in about compassion training and does it work in healthcare, and the lovely book Compassionomics, which reviews all of the research, talks about the meta-analyses showing that compassion training is highly effective, because basically what we're doing is developing what is a natural inborn emotional regulation system, to be present with others, to listen deeply, to seek to understand from their perspective, to empathize, and then to help. So that's very encouraging. And somebody else, Helen, has asked about what your 7 leadership principles are. And rather than ask you to read all of those out, I think that they're readily available, aren't they, on the Health Education Improvement Wales leadership portal website? Is that where they can be found?
They are. I can put the link in the chat, but we've recently enhanced them so they are interactive. So one of the principles being, create conditions for teams where you can work across boundaries. That's great as a principle, but how do we do it? So what we've done now is made them interactive. So when you click on that principle, you will have case studies and exercises, tools, reflections, and hopefully a range of resources to help you deliver or embed that within your organisation or team.
And you have a nascent compassionate leadership training program for the whole of Wales. I know also Berkshire Health has been retraining all its staff for the last 5 years in compassionate leadership, and they now have the lowest levels of staff stress and the highest levels of engagement of any comparable health service organisation in the United Kingdom. We've also got a question about, what a partnership model looks like. And, as I said, I think what we know is frequent contact between partners is important, not with long agendas and huge numbers of items, but just people getting together, shaping a shared vision, having a commitment to long-term goals. We've had wonderful examples of a commitment to changing healthcare in the long term, managing conflict effectively, but always underlying all of that, the commitment, a compassionate commitment in the partnership relationship to asking the question, how can we help? And here's a question from Adrienne, who says, really enjoyed the practical examples. Do you have ideas about how we can maintain the momentum and innovation that came with the pandemic while, maintaining governance and patient safety? It seems to be a real tension, this. We kind of reflex back into regulation, caution, and limiting innovation. How can we maintain that momentum and innovation that we had during those early months and years? Katie, do you have thoughts? I mean, you've done a lot of work leading culture change. Yeah.
I mean, it is the endless tension, isn't it? I think a lot of the lessons that we learnt during COVID were about, if you like, the need for the top to get out of the way, and that's certainly language which Oxfam is using, and their philosophy is that you really have to not just share power with people at the grassroots, but create opportunities for them to have power, to have opportunity to innovate, to remove some of the protocols which weigh them down, the need to report so often, the need to report on kind of detail which doesn't really build a great deal of understanding about the quality of what's being provided on the ground. So I think there are structural and cultural changes, but how we, if you like, kind of engineer the system so that happens spontaneously. For me, there's something about, I just think a lot of organizations are very, very large, and the top doesn't have a lot of empathy with the bottom. And so we're trying to make too many decisions at the top, or we're not creating environments in which the top is close enough to what's happening on the ground for that decision making to be realistic. So there's something about the size and something about the structure as well.
And I always think, healthcare systems usually have the largest and most motivated and most skilled workforce in countries. Why on earth would we manage them largely through command and control? It makes no sense, and it suppresses innovation. Yeah.
I have maybe one point to add to that. During COVID, we worked with many different partners to create a COVID monitoring WhatsApp chatbot in 6 days. So to go from paper to something in 6 days. I've never done anything in 6 days otherwise. And, you know, there's something about pausing and reflecting and looking back on what we achieved and how we achieved it and celebrating it. And if I do look back, I think that there was something about a shared vision, a sense of urgency, that there were 2 or 3 key leaders who definitely removed the blockers and allowed this sort of cross sectoral collaboration to happen, which then allowed a left of field thinking, which we don't often do in healthcare, because often healthcare just collaborates with healthcare and we all think in the same way. And there was a real commitment that we had to do something together and fast. And there are plenty of these urgencies still around. And we evaluated this project, and I think it's really important that when we do innovate in healthcare, that we evaluate in order to then really understand what is it that works, that we can then continue the momentum, but based on the evidence that we've created. So I think that those points I would also add to what Katie was saying.
So look, I feel really bad. I see that we only have about 3 minutes left of our webinar time. I feel bad because I should have scheduled a whole day for this amazing conversation. And for the little time we've got left, I want to ask each of you just to, what would be your single important sharing that you would like to offer those who are listening, based around this question of how we can transform healthcare through compassion. To give you time to think, I want to share one thought. For me, it's about, in all our interactions in our work, is having the courage to be present with each other and to be present with ourselves, to be present with each other and to be present with ourselves. To enable connection with each other and compassionate connection with each other and compassionate connection with ourselves. So let me open it up to the 4 of you for a final comment. Just jump in when you're ready. Yes, Rachna.
Yeah. So Michael, don't feel bad. Be self-compassionate is what I would say. And it always starts with us. So how could I not agree with compassion to oneself? And then whenever we remember, and when we don't remember, it's always a moment to be compassionate to oneself, and we just do our best.
Thank you.
I think mine is to hold on to the hope that compassion is something which we know it when we feel it. And the more of it we create in our organizations, the more people will feel it. And that's the way I see the culture changing. It's spreading through this sort of contagion of, this just feels better than the other way.
It radiates out, and is replicated, and not simply reciprocated. Yeah. Thank you.
So maybe I can follow that, because what I was going to say about feeling quite optimistic. Compassion can seem a very big word, as if it's this faraway quality that one hasn't got. But I think as soon as we're present and kind and light-hearted, we are compassionate, and a little bit can go a very long way. A little bit can go a long way. So that's what I would like to say.
And I was going to say something very similar, so to build on that. It is being mindful and having awareness of the impact you are having, because you do impact a number of people that you may be aware of, or you may not even be aware of until maybe a significant time later. So being kind and mindful of how you are interacting.
Well, thank you. This has been a delicious and privileged experience for me, and being with you with this last. I want to thank the Global Compassion Coalition for all of the work it's doing in developing compassion around the world in various domains, including healthcare, of course. Thank you to Alex and Christine, who've organized all of this technically and logistically. A huge thank you to my dear colleagues and friends on the panel, Katie and Vijamala and Helen and Rachna. It's been a joy having a conversation with you. We should do this every day. The link to the healthcare cluster in the Global Compassion Coalition is in the chat function, and we'd welcome all of you welcome your involvement, and we welcome your case examples from all of you in your various countries and systems and communities. So above all, thanks to you for joining us, and warmest wishes to you all. Thank you very much.